Welcome to the Lexington Public Library's Tales from the Kentucky Room podcast, where we discuss everything Lexington and Fayette County history. I'm Miriam, and in each episode of this podcast, we will feature a guest that will share a piece of local history. So thank you for tuning in and enjoy.
The headline of the July 20, 1882 Cincinnati Post read, "Dr. Harpham, city physician at Lexington, has resigned. He was afraid to treat smallpox. He'd better dig vaults for a living." I'm Jamie West, branch manager of Marksberry Family Branch Library, and today on the podcast, we're going to take a closer look at one of the many concerns of Lexington citizens and their day-to-day lives in the Lexington of nearly 150 years ago. While Lexington's cholera epidemics get more attention in research, its citizens also suffered from many other diseases and outbreaks as well. And at the time of Lexington's founding in 1775, one of the most feared everywhere was smallpox. In a letter to Patrick Henry in 1777, George Washington wrote about smallpox's effect on the Continental Army and said, "I know that it is more destructive to an army in the natural way than the sword." Smallpox was a nasty disease, covering the body with large, fluid-filled blisters that eventually fell off and left scars, and the death rate was about 30%. It's estimated that 300 million people died of smallpox just in the 20th century before it was declared eradicated in 1980. Around 400,000 people per year died of smallpox in 18th century Europe. In Kentucky, the state passed aggressive legislation in 1798 to heavily fine those who spread smallpox and to encourage quarantine and inoculation. Inoculation is the act of artificially inducing an immune response by introducing the body to bacteria, viruses, or other microbes. Lexington's Kentucky Gazette newspaper references smallpox inoculation in Lexington as early as 1794. The earliest smallpox outbreak in Lexington was believed to have been brought from the soldiers returning from Washington's army in the 1770s, and with regular outbreaks afterwards. Inoculation was well recognized as effective by that time, and by the 1880s even more effective vaccines had been developed and were actively purchased and supported by many communities to slow its spread, with Lexington among them. Lexington doctors were even financially rewarded for vaccinating citizens, getting 25 cents per vaccine given, around $8 in today's money. But cities didn't stop at inoculation and vaccination to help reduce the spread of smallpox and other diseases. In Lexington, the city established, funded, and ran a smallpox hospital starting in the 1860s as yet another outbreak began, to ensure that smallpox patients could be quarantined and cared for free of charge and outside of the general population. The smallpox hospital was maintained by the city physician, which was a salaried city position appointed by the city commissioners. In addition to treating the patients at the smallpox hospital, the city physician was also responsible for investigating reports of illnesses like smallpox or cholera, and if the report was confirmed, would then quarantine the house or ensure that the unfortunate patient was brought to the smallpox hospital, which was well outside city limits. Which brings us to the year 1882. In 1882, Lexington was already over 100 years old, had just installed its first telephone service exchange, and was building Woodland Park. And a doctor named James C. Harpham accepted the position as Lexington City Physician in May with a salary of about $400 per year, about $12,372 today. J.C. Harpham had been practicing in Lexington for a few years already and was 29 and newly married. When he started in May, Louisville newspapers had just announced another smallpox scare and new cases, and Lexington was also experiencing an increase in cases as well. The city hired a horse for their new physician's convenience since the smallpox hospital was a few miles outside of town, intentionally isolated with its own staff to decrease exposure and spread. 2 months later, in July, Lexington's mayor fired Dr. Harpham as certain rumors were confirmed as a terrible scandal. While James Harpham rode out every day to the smallpox hospital, he admitted that he had never once stepped foot into it since he was afraid of catching smallpox. Keeping up the deception, nothing was noticed for weeks until the hospital's potentially infectious attendants were noticed coming into town every day and mixing with citizens, having been left without any doctor to treat the patients at the hospital. By mid-July, 4 of the smallpox patients had died without having received any medical treatment, and the city immediately installed another doctor to take over as city physician in his place. Area newspapers immediately picked up the story, reporting Dr. Harpham's resignation and intent to leave Lexington. By September, Dr. Harpham and his wife left Lexington, and he soon established a practice in Texas, where he later died in his 70s after a successful medical career. While medical malpractice was absolutely a concept in 1882, it was not common, and state licensing was only beginning to be developed. Before the 1960s, legal claims for medical malpractice were very rare and did not often impact the physician's career. In this particular case, the doctor was able to avoid legal penalties by moving his family to a brand new town in an undeveloped area of the young state of Texas. The city eventually stopped funding the smallpox hospital, and it was officially declared eradicated in 1980, and is the only human disease to be successfully eradicated. However, the reality of smallpox was very present to Lexington citizens from its earliest days and could often be deadly.
Thanks for listening to Tales from the Kentucky Room, a podcast brought to you by the Central Library's Kentucky Room staff at the Lexington Public Library. If you enjoyed listening, please take a minute to subscribe, rate, and review the podcast on Apple Podcasts, Spotify, or wherever else you get your podcasts. If you have any questions about local history or genealogy research, you can visit us in the Kentucky Room to use our collection and newspaper microfilm, or you can email us at elibrarian@lexpublib.org. That's elibrarian@lexpublib.org. I'm Miriam, and we'll be back with another trip down Lexington's memory lane.